In this video, I want to talk through the idea that hopelessness is a cause of suicide and the desire for suicide. And there's been a number of people that have explored this idea. In fact, for many of us, it may seem intuitive and obvious, but in a lot of ways, the sophisticated view of this really didn't come about until a few researchers and theorists started working together. And one of those was Lynn Abramson. She developed the idea that hopelessness was sort of a type of depression and viewed it as pretty critical in the experience of depression and a contributor to suicide. But the one I want to talk through today is actually Aaron Beck. And so if you don't know Aaron Beck, he is a top figure within psychology. I'd probably put him in the top 25 psychologists. And he came up with a theory of that he called cognitive therapy. And it was a type of therapy that really contrasted with what went before. It was in the 60s and 70s, the dominant approach to therapy. Of course, you had the psychodynamic therapists and psychoanalysts who followed in the footsteps of Freud, but the more scientific approaches to therapy were largely based on behaviorism. And behaviorist therapists would focus on identifying reinforcers and punishers, so rewards and punishers for behavior, and would focus on also triggers, understanding what was the classically conditioned precursors for a behavior. So it was largely out there. It was trying to identify what was outside of the person that shaped them to behave certain ways, including shape them to behave in suicidal ways. Cognitive therapy was a big shift because Aaron Beck argued that we should focus on not just the environment, but also on the person themselves, the way that they viewed their environment and how they thought. So his treatment of depression, cognitive therapy, involved identifying dysfunctional cognitions, fancy word for thoughts, dysfunctional thoughts, thoughts that led to depression and sadness and difficulty adapting to stress. And what he would do is he would subject these thoughts to evaluation, a process of questioning and interrogation of the thoughts, and really trying to identify if they're true and if they're helpful and if they're producing the kind of ways of viewing the world that are really most adaptive. And again, it was significant because it really shifted from outside of the person back inside the person, in particular the way that they were perceiving the world. And what Beck said is the key thought for someone struggling with thoughts of suicide was hopelessness. According to Beck, hopelessness is a distorted interpretation. It develops as a result of a systematic process of misconstruing your life and what's happened to you as these dire and negative events, sort of a snowball effect of things are going bad and they're just seemingly progressing towards getting worse and worse. So Beck said this is a negative attributional style. And when you think about the future, an attributional style says, well, how am I going to determine what the future looks like? If you have kind of assigned a cause to an event that things are always negative, you kind of forecast a future that your life is going to be bad. And so with hopelessness, that is the prediction that you are going to continue to experience these terrible events in your future. And so suicide to the person who is hopeless actually seems like a reasonable solution, because if their future is full of pain, full of continued problems and terrible events, suicide doesn't seem so bad. But Beck really emphasized that interpretation, the view that suicide was a reasonable solution to just terrible outcomes, was really based on a false notion that exaggerated the problems that a person is facing. So Beck argued that the situation was never as bad as the person perceived it to be, and that for every case of hopelessness, the person, if they were able to view their situation differently, might actually feel differently and might see suicide no longer as a reasonable solution, in fact, as a worse solution for their problems. Now, the question is, okay, that has a nice theoretical framework for the problem, but does it actually predict suicide? Now, the best way to evaluate that is not to just measure, okay, if a person is hopeless, do they have thoughts of suicide? The best way is actually to say, is there predictive validity? If you measure a person's hopelessness, does it predict in the future what happens, including do they actually take their life? And so in a large-scale study, Beck administered the hopelessness scale that he created. He gave it to over 1,000 participants that were at high risk of suicide, and he found that it actually predicted suicide at 10-year follow-up. So that 10 out of the 11 suicides that occurred in the sample, again, it was a high-risk sample, 10 out of 11 had elevated hopelessness. And the mean hopelessness score was significantly higher among patients who died by suicide than those who did not. And not only did Beck do this a single time, but he actually did a replication of it. Because sometimes in research we find things, but it doesn't hold out the second time around. But the replication study confirmed these findings, that you can use hopelessness to predict who will die by suicide. Again, that supports this notion that hopelessness is plays some sort of role in suicide. Now, there's been a few other studies that supported it, and one of those was by Klonsky et al., who found that hopelessness predicted attempted suicide in psychotic patients 4 to 6 years later. Again, a different sample, but they found that it was, again, a predictor of suicide. And it's also a predictor of self-harm. So again, it seems to be a key role in this desire for suicide and also for self-harm. Now, Beck again had some sophistication to how he viewed hopelessness. He argued that it should be considered both a state and a trait. So a state is a temporary condition. It's on a bad day, a person might become hopeless, and they might emerge out of it shortly after. A trait would be more of a long-standing characteristic, and we know that some people have greater amounts of hopelessness as a consistent element throughout their life, and it's not as much individual circumstances that make them feel hopeless, it's just how they view it largely. So while hopelessness may vary, the hopelessness present at one crisis is probably a strong indicator of the likely hopelessness in the next crisis. So this is what Beck argued, that if you were trying to predict how hopeless will this person get in the next crisis, in the next state, where they, again, if in the past they've had very elevated rates, then you can expect that they will reach that level again, approximately, maybe higher, maybe a little bit lower, but be roughly just as hopeless the second time around, the next crisis occurs. And if they were lower on hopelessness, they would be low on hopelessness next time around. And it really doesn't matter what the trait was, the state and the severity of the state was the best indicator for how that person might feel in a crisis. Now, the hopeful, and I use that to kind of connect this, the hopeful part of this idea is that in Beck's framework, hopelessness can be altered, it can be modified, and you can do that with therapy. So he showed that with cognitive therapy, people would have reductions in their hopelessness. So that gives a lot of hope and a lot of optimism that that if you treat the hopelessness, if you reduce the hopelessness, that person who might otherwise take their own life could actually survive and be able to go on with life and again experience less amounts of hopelessness and hopefully more amounts of hopefulness. And in a sort of slightly joking matter, he mentioned that there's no risk of accidental or intentional overdose with therapy as you can have with medication. Now, one concern is that false positives can occur. So you did see that 10 out of 11 of the suicides, so roughly 90% of the suicide deaths had high hopelessness. And the concern, though, is that there are many people who have high hopelessness but don't go on to die by suicide. And this possibility of having a false positive is a issue with any rare problem. Anytime, and suicide is a rare issue. It does not occur frequently. Although we have over 48,000 deaths per year of suicide, that's a concerning number. That's really in the large scale a pretty small fraction of the population. So trying to identify who will go on to kill themselves and distinguishing them from those who don't is difficult. But Beck argued that when a person is wrongly identified as suicidal because they take this hopelessness questionnaire and it finds that they're elevated on hopelessness, he argued it's not really a problem that you think that they might be at risk of suicide, because and that false positive rate was 59%, which is pretty high. But suicide is not just as simple as presence or absence of diabetes or tuberculosis. In those cases, false positives can have some negative outcomes. You don't want to start someone on insulin if they don't need it, or medications for tuberculosis if they don't need it. So the lack of a suicidal outcome doesn't indicate health for the individual. So we should be concerned about functional impairment and suffering of the individual, even those who do not kill themselves. Just so to put this more simply, if a person reports a high degree of hopelessness, Beck is saying we should be concerned about that person. We should get them help and support and really alleviate that sense of hopelessness that they're experiencing. So just as those with high blood pressure should be monitored on an ongoing basis, those with high hopelessness should be evaluated regularly for the potential of suicidality. So that's the argument that Beck made. Now, the criticism, and I'll get to this a little bit later, is that hopelessness actually seems to be an important factor in suicidal ideation. But when you have a person who is thinking of suicide, hopelessness doesn't tell you if that person's going to attempt or not attempt. So if you think about it as a step, hopelessness seems to be a step towards thinking about suicide. It doesn't necessarily seem to be a factor that leads a person who's already thinking about suicide to getting closer to attempting suicide. Hopefully that makes sense. So when in this more recent research, they argue that the reason why hopelessness might be connected to suicide might be because it's connected to suicidal ideation. Hopelessness may not actually distinguish ideators, suicidal ideators, who attempt from ideators who do not attempt. And in that case, It might not be the most precise component that tells us who will attempt or who will die by suicide. Okay, so that's been some criticism of it. But nevertheless, when you think about suicide, obviously hopelessness is an important factor, and it's an important target for clinical interventions because, again, it suggests that if you can reduce the hopelessness, you can reduce the thoughts of suicide. All right.